the adolescent. So what would be the dental formula of the young person here? I didn't put it down here. These are incisors. I think it's 212. So 2 incisors, a canine, and these 2, I don't know, I think they call them premolars, I'm not sure. There was something funny about this though. So this is a dissection of a person that still has some of their deciduous teeth. And as I looked at this last night, this is just from your book. So there are 2 incisors, a canine, 2 premolars, and here's M1, M2, M3, but they should only have, if these are the juvenile teeth, they should have 2 incisors, a canine, 2 premolars, but there's another premolar. There are 2 premolars here. And they have, yeah, I'm not sure what's going on there. So I'd have to have a dentist explain that to me. But what you can see is the adult pattern versus the pattern of childhood here. And then, so I just ask what's going on in this jaw. This is an adult jaw, I think. So look at right there, look at that tooth. So that's the 3rd molar, often called the wisdom tooth, that they don't erupt. Often they don't erupt. Okay, so here, this is something that I'm sure you're going to be concerned about. So this is our nice drawing, and I think, so these come right out of your text. Well, no, this one doesn't come out of your textbook. I don't think this might have come out of Akima, but you have something in here, in your textbook just like this, that will label these. And I have some of these, some of the more important ones, like certainly the orbicularis oris, you'll see that. The buccinator is important just because, so can you see that? Yeah, you see the buccinator, I have it labeled. This muscle would be the masseter right here. We've taken away the buccal fat pad and then shown that buccinator. There's a zygomaticus muscle, zygomaticus major right here that's pretty prominent. A mentalis, mental tubercle, as mental is referring to the chin, so that's a bit of vocabulary that will help you just associate the mentalis muscle with, it's kind of going to draw the lip, inferior lip down, fold it down. And then these, depressor labii inferioris and levator labii superioris, they're hard to point to, especially in this right here. Like I'd be guessing, but I know what they do. You know, you kind of know what you're talking about if somebody mentioned those terms. So that's familiar vocabulary, but I wouldn't be asking you to point something out. And then this muscle, okay, see this long muscle right here running along the nose? I just point that out. Maybe you already know this from musculoskeletal. Here's its name. This little thin muscle that you can't see at all here, it's so thin. But it is there for real. It's the levator, so elevates, labii, so it's going to elevate the lip. Aliqui, nasii, means it's along the nose. Superioris. That's the longest muscle name in the world. Yes. Yes, it's right there. So it goes up like at the corner of the eye and runs right along where the nose meets. Yeah, it would be. That's getting up there towards the lacrimal. Part of it is transected and taken away right here. Okay, and I'm going to tell you right now, this will not be on your practical, and I won't ask you to write out the name. But now you've studied the muscles of facial expression, and you know the longest name of any muscle. Was that a question? You were just tracing it out. You're going to be disappointed if I don't ask you this now. So what? Yeah. I won't ask you that. So Yeah, all right. So then, this can be for your review unless you have any questions right now. I mean, I'm not gonna go over this, but I'm just kind of reminding you of what we talked about in terms of skeleton, and for you guys, it was review, since you've already done osteology. But now, here's just a little dissection that we're gonna take from, I took this from Rowan's Atlas. I think, do you guys use Rowan's? Do you have that? Hmm? Some people do. Okay. Okay, so this is from Rowan's, just for your information, but I think everything you need will be on these slides to look at this. This is like a progression of a particular dissection. So this face, of course, has been skinned in this specimen. His ear has been external, the auricle has been removed. Deep fascia has been taken off of this. What muscle is this right here? Temporalis muscle. This is the superior attachment. And what muscle would this be right here?
Sternum.
Yeah, that's the masseter muscle. And the masseter muscle is attaching superiorly to what bony process here? And it's attaching down here, we would say, at or angle. Obviously, sometimes, yeah, it's normally talked about as the angle, but you're right. I mean, some of it is attached to the ramus, some of it is attached to the body, but it always includes the ramus. I mean, the angle. Okay, so now we're going to, the goal here is to display all these muscles of mastication, or the chewing muscles. So we see the temporalis, we see the masseter. Now, what have we done here? The next step was going to remove the belly of the masseter muscle. So now we can actually see, oh, and we've done one other thing here. We've removed the belly of the masseter muscle, and what have we done here? We made two sections through the zygomatic arch and taken that away. So now that gives us a clear view of the coronoid process of the mandible, and we can see the convergence of all these temporalis muscle fibers onto this tendon. Now it's this fan-shaped tendon, and here it is attaching to the coronoid process. And if we look through this mandibular notch right here, we see we're looking into the infratemporal fossa. And that's where we expect to find those two pterygoid muscles. Before we do that, though, let's just look anterior here to the ramus of the mandible. Look at this muscle right here. So where would that be? So here's the skin of the neck right here. I think it hasn't been skinned at all. So we're like right here. That's the buccinator muscle. There's a gland, there's a duct running through there. We'll talk about that another time. So that's the buccinator muscle. So right here is where that buccal fat pad would be that kind of gives that roundness to the cheek. That's been taken away. Okay, let's go to the next step in this. So here's where we were. So we've taken away the masseter, the zygomatic arch. Now where these red lines are, we're going to make two cuts. We're going to cut through the neck of the mandible, and we're going to cut through the ramus. And those cuts are shown here in this isolated mandible. And then this piece of bone right here, we're going to take away. So now, once we've done that, here's what we're left with. So here again is that buccinator muscle. And then what do we have here? Well, okay, this one would be pterodactyl is right. So this is, so these, you're wondering where the pterodactyl came from? Is that? Medial and lateral pterygoid plates of the what bone? Yeah. So the sphenoid bone looks like a pterodactyl, right? So that's where it is pterygoid. So you know where they're attached now. Pterygoid plates. So, yeah, so here's the lateral pterygoid, and those fibers are running horizontal, and they're inserting into the head and neck of the mandible. They'll even insert into the joint capsule of the temporomandibular joint and pull. There's a disc that sits between the head of the mandible and the temporal bone, and it will pull that disc forward when you open your mouth all the way. And then you can see here, just medial to the lateral pterygoid is this muscle. And that would be the medial pterygoid muscle, and that's the one that runs parallel with the masseter muscle. Both insert onto the mandible near the angle of the mandible and are powerful closers then, okay? So that's kind of our dissection for the day. And then this gets, what do I have here? I have lateral pterygoid, medial pterygoid. They're not as obvious here. You can still see them. Here's the lateral pterygoid. Here's the medial pterygoid, because in this dissection, they haven't taken away the nerves and arteries. So the arteries, this artery right here, I'll just ask you, what artery do you think that would be?
External carotid.
That's the maxillary artery. So that is a terminal branch of the external carotid artery, and that's going to be one that supplies, of course, all these muscles, but also the teeth by way of, I'm not even, do I have this? Yeah, okay, so there's an inferior alveolar artery that I don't have listed, and that's fine. All you need to know is maxillary artery, and it gives branches to the teeth. Now down here, I talk about the trigeminal nerve, the mandibular division of the trigeminal nerve. And we can actually see parts of that right here, this white layer right here. And there's another nerve right here that's actually going into the bone, the mandible. That is the inferior alveolar nerve. That's what's listed right here. And then the mandibular nerve, so now here's one of those places where I probably have more detail than really need to do this. You don't have a cadaver to look at. So we have the mandibular division of the trigeminal nerve coming out of the skull into this infratemporal fossa, and we already said it's going to supply the teeth. It's going to supply general sensation to the tongue, and it's going to supply general sensation to the cheeks, okay? I think that's really what you need to know, but these are the names of the branches that actually carry out those functions. So the inferior alveolar nerve, that's referring to the alveolar process of the mandible. So that's the nerve that's going to innervate the teeth in the mandible. The lingual nerve, of course, that's going to be going to the tongue, general sensation to the tongue. And the buccal nerve is this nerve right here. It's actually going to go through, it's not going to innervate the buccinator muscle because that's a muscle of facial expression. It's innervated by 7. The buccal nerve, which is a branch of the trigeminal nerve, is going to go through the buccinator muscle and innervate the mucosa lining the inside surface of the cheeks. Is this getting way too twisted now? A little bit? Yeah, so that's more than enough detail. That's probably, I just let that sink in. Everybody sees like kind of who's who on the in that dissection now? No? Yeah? Yes?
Can you point the external carotid artery again?
The external carotid, I see it's time for us to take a break too. You can't see it very well right in this section. I see part of it right here. It actually, so look at this. This is the superficial temporal. That's not something we talked about, but there it is. That's one of the terminal branches of the external carotid artery. The other terminal branch is the maxillary, which you see right here. So I think this would be the external carotid, but I don't really see where it actually ends by giving rise to these two branches. That's kind of disguised in there. And else do I have here? Yeah. So does anybody see the facial artery on this? So remember, it crosses the body of the mandible, and if you're careful, this is not easy to do, but you can get the pulse of it. Is it like right here? So let's follow along this mandible. Look at right here. That's the facial artery right there, and it's always twisted like this. It's very tortuous. So it's like it's longer than it needs to be, so when you open your mouth really wide, it just kind of straightens out a little bit, but it doesn't get pulled. So blood can still flow through it. Okay, so let's go ahead and take a break. I'll